Our case today is about a 27-year-old male who presented to urgent care with urinary and abdominal complaints, including hematuria and incomplete bladder emptying. A bedside POCUS exam performed to evaluate for retention and renal colic instead uncovered an unexpected bladder mass, prompting expedited CT imaging and follow-up. This case highlights how POCUS can uncover critical pathology, avoid unnecessary imaging, and accelerate diagnostic evaluation. Dr. Tatiana Haverluk is an emergency physician and founder of Hello Sono. With 15 years of experience using POCUS in diverse settings, from urban EDs to Everest Base Camp, she is dedicated to extending its benefits to more patients. With Hello Sono, she and her team support practices in building compliant, high quality, and profitable POCUS programs through tailored education and implementation. So, Dr. Haverloop, good to see you again. How you been?
Good, thank you. Happy to be back.
Good, excellent. So tell us about this case.
Well, we've got a 27-year-old healthy male who showed up to an urgent care with some urinary symptoms, flank pain, testicular pain, hematuria. Really sounded like a potential kidney stone picture, maybe some urinary retention, UTI symptoms. So the provider ended up performing an ultrasound looking for hydronephrosis and potential urinary retention. So looking at the bladder volume. And what they ended up finding was a bit surprising and unusual, but we've got an image pulled up here. They ended up seeing a hyperechoic mass in the bladder, and I'm pointing it out currently, right? So, and I'll pull up a normal image of the bladder now. So this is what a normal bladder looks like. We've got just anechoic area, that fluid appears anechoic, like urine should appear anechoic, unless there's blood in there that's coagulated, but you shouldn't be seeing hyperechoic areas. And here the wall of the bladder is also nice and thin, which is normal. Uh, and going back to this pathological slide, we are seeing very obvious mass over here that is very unusual. And that basically led to the provider expediting care for this patient. So they ended up getting him in for a CAT scan and cystoscopy because the suspicion for bladder cancer was really high. So I think that's once again the benefit of point of care ultrasound here, that it just lets you make decisions quicker and expedite care.
Just to do this type of scan, would you say this is a beginner, intermediate, or advanced level?
Oh, this is total beginner scan.
So obviously the benefits are pretty obvious. What are some of the limitations, maybe?
I think limitation of using ultrasound for cancer screening in general, that's not the typical indication. Usually point of care ultrasound is a very focused exam where we ask specific questions. Is there bladder distended? What's the post-void residual, for example? Or is there hydronephrosis? We are not necessarily looking for any kind of masses or size abnormalities of the kidneys uh, on a point of care ultrasound. That's what a comprehensive ultrasound would do. So I think that's an important limitation. But as with any imaging, we do find incidental things on ultrasound, as in on CAT scan, MRI. And when you do find these incidental things, you've got to tell the patient and have some kind of follow-up plan for them.
Yeah. So what was the follow-up, or what ended up happening with this particular case?
Yeah, so he ended up getting a CAT scan, and the CAT scan, there was a concern for transitional vesicular carcinoma, and he ended up getting referred to urology for cystoscopy. So I think in his case, it was lucky that it was actually caught pretty early on. So he has a good chance of having a positive outcome.
Oh yeah. Not what you were looking for, but life-changing as it pertains to what it could have been further down the road had it not been caught. Um,
Yeah, and I wanted to also tell you that in my clinical experience, that has happened, fortunately and unfortunately, multiple times when I was looking for something else. For example, someone with younger patients' abdominal pain. You know, I would be looking maybe at their kidneys, so seeing whether the bladder is distended, and then I would find like an ovarian mass that's very, very obvious. So maybe that's a patient I would have not have gotten a CAT scan in the emergency department. Now, obviously, I'm going to expedite care and do a little bit more and get them through to follow up easier. So I think it's especially useful in places where access to care is not as convenient, or maybe there are imaging delays, or also considering the patient, right? Are the patient going to, how soon is the patient going to follow up? Right now you have them right in front of you, and you can do some diagnostic testing versus letting them go, and then you don't know when they're going to get the CAT scan or the next step.
You're finding things. Is there a financial advantage to the provider for being able to find these things that you wouldn't normally see?
It makes sense. I mean, the question is there like a financial value to do point of
Benefit
care ultrasound, a benefit in this type of case? I
to
mean,
finding
it
things.
depends, right? So if you are in kind of in a direct fee type of model, obviously, whenever you're doing a diagnostic point of care ultrasound, it comes with CPT codes and you can bill for it. It's not a huge amount, but it's probably somewhere from $60 to $100 in a global payment that you would receive for something like that. Um, but then there are also a lot of primary care uh, offices, they're in capitated models, or they're tied to a hospital system or value-based. So you got to think about it also in broader terms. What are the actual cost savings on this patient, right? So you picked up bladder cancer early on and expedited management. So hopefully this patient can do better and is not going to need um, as of an extensive treatment for this cancer if you in comparison to if you were to catch it later on in the disease process. So there's that huge benefit. But I think the biggest thing is you're doing the best possible care for the patient, and that's why we do medicine, right? Is to give that to the patient. The technology is there, the education is there. Like, why aren't we doing?
Not necessarily that it's preventative, but it's early detection, saving lives and costs downstream.
Yeah, I hope it was obvious for our viewers, I guess not quite listeners, but looking at the normal image and then the abnormal image, right?
Yeah,
The normal image just had black fluid inside the bladder,
I
and the
get
abnormal
that.
image has a mass, and you can do it.
Please support our mission to improve quality of patient care through education. Join us, follow us, and share this content with family and friends.